Okay, so good evening, everybody. My name is Patrick McKeown, and for the next 20 minutes or so, I'm going to go through all of the breathing exercises as it would pertain to respiratory conditions. I know our motive for putting this together is based on the current COVID crisis. Coronavirus, this is not the first time it has been around. We did have a family strain of this back in the 2003-2004. There was research back then, published in 2005, looking at nitric oxide and how it could inhibit the replication of coronavirus. And back then it was SARS. Covid19 is also a coronavirus. COVID stands for coronavirus disease 19. Now, a number of things that I'm going to go through. One is, what would you do when your breathing gets labored? Number two, how can you breathe to improve oxygen uptake in the blood? So if you do have issues with your lungs, what's the best way to optimize ventilation? That if your lungs are compromised, and even if you do have a pre-existing condition, what's the best way to enhance alveolar ventilation? Another aspect that we will look at is measuring your breath hold time, and also then practices that you can bring into your daily life. I've been using these breathing exercises for almost 20 years for people with respiratory complaints. We've had many people over the years with asthma, COPD, bronchiectasis, sarcoidosis, different lung issues, and of course with that, individuals with anxiety, panic disorder as well. The first thing that I would say to you is that in order to get an idea of respiratory function, your breath hold time during rest provides you with a good indicator. If there is an issue with the lungs, your breath hold is generally reduced. The length of time that you hold your breath for is not going to be as high as it should be. So one of the symptoms of COVID-19 is breathlessness. And since 1975, researchers have known that using breath hold time, you can measure the degree of breathlessness. There is a feedback, of course, from the brain to your lungs, but also from your lungs back to the brain. If your lungs are bronchoconstricted, or if your breathing is not optimal, it will reflect in a lower breath hold time. So what I would say to you is keep an eye on your breath hold time. And the most important breath hold time that you would measure is the one that you measure first thing in the morning. As soon as you wake up, sit on the bed, allow your breathing to recover, and measure your breath hold time. If your breathing is labored, your breath hold time is reducing. An optimal breath hold time would of course be 40 seconds. Does everybody have it? No. Functional breathing tends to be when your breath hold time is above 25 seconds. And suboptimal breathing is when your breath hold time is less than 25 seconds. So in order to measure your breath hold time, it's not the maximum length of time that you hold your breath for, but it's the length of time that you can hold your breath for comfortably until you feel the first definite desire to breathe, or until you feel the first involuntary movement of your breathing muscles. So to measure your breath hold time or control pause from Buteyko, it's Bolt score from Oxygen Advantage. You would need a watch with a timer or a second hand. You take a normal breath in through your nose, a normal breath out through your nose. You hold your nose and you time it in seconds until you feel the first definite desire to breathe. Corresponding with that, you may feel that there's an involuntary contraction of the diaphragm breathing muscle, or you may feel that there's some tension in the throat, or you may feel the first definite desire to breathe. So your breath hold time, keep an eye on that in the coming days and weeks and months ahead. If you do have symptoms of breathlessness, it's very important that you don't breathe fast and shallow. And this is ironic because when you feel breathless, whether you have an existing respiratory condition, it's very common with people with asthma, very common with people with respiratory conditions, that when you feel breathless, of course you are feeling that you are not getting enough air. there is a feeling of air hunger. And what that will generate is that automatically people will start breathing faster. They breathe more shallow. They often have their mouth open. And that's only going to feed back into your symptoms. So it's entirely the wrong thing to do. Anytime that you are breathless, even if you have wheezing, if you have coughing with asthma, if you have respiratory complaints, the optimal way to enhance alveolar ventilation, in other words, the amount of oxygen that's reaching down into the small air sacs in the lungs, because ultimately we breathe, that oxygen is taken into the body so that oxygen can transfer from the lungs into the blood. And with COVID-19, one of the recognitions is that when there is a severity or a progression of the disease, blood oxygen saturation decreases. Now, so there is a way to breathe to enhance blood oxygen saturation. It's not by breathing fast and shallow, but it's by breathing very slow and breathing deep, in and out through your nose. So the best way to think about breathing is that it should be light, it should be slow, and it should be deep. And some of you will remember it if I say the acronym LSD. So you're thinking about light, you're thinking about slow, and you're thinking about deep. And what I would like you to practice is put your hands on either side of your lower two ribs, just where you can feel the base of your lungs where it meets the abdomen. And separating the chest from your abdomen is your diaphragm breathing muscle. So it's by having your hands either side of your lower two ribs with your lips together, breathing in and out through the nose. What I would like you to do is to really slow down the speed of air coming into your nose. So you're taking a soft, gentle breath in. And as you breathe out, you're having a relaxed and a prolonged exhalation. And as you breathe in, you should feel that your lower ribs are moving out. And as you breathe out, you should feel that your lower ribs are moving in. So as you breathe in, you should feel that your lower ribs are moving outwards. And as you breathe out, you should feel that your lower ribs are moving inwards. It can be good to time it. And especially during rest, an optimal breathing pattern or rate would be 6 breaths per minute. So you could breathe in 2, 3, 4, out 3, 4, 5, 6, in 2, 3, 4, out 3, 4, 5, 6, in 2, 3, 4, out 3, 4, 5, 6, in 2, 3, 4, out 3, 4, 5, 6, in 2, 3, 4, out 3, 4, 5, 6, in 2, 3, 4, out 3, 4, 5, 6, in 2, 3, 4, out 3, 4, 5, 6. And if you continue like that, so you are breathing in for a count of 4 seconds. You are breathing out for a count of 6 seconds. But during rest, you should not hear your breathing. When we think about breathing, we have to think of 3 pillars to breathing. The first is the biochemistry, the biochemical dimension of it. The second is the biomechanical dimension. And the third is cadence breathing. Each pillar or each leg of a stool has its own merits. When you are changing your breathing patterns, it's important that you don't increase minute ventilation. Don't breathe harder than what you feel you need to breathe. The harder you breathe, it can contribute to bronchoconstriction. And we often see it with people with asthma. They feel that their airways are getting tight. They feel that they are not getting enough air. They start to breathe harder in an effort to get rid of the feeling of suffocation. But this causes their airways to cool and dry out, and this feeds back into airway narrowing. So when you're thinking about breathing, Think of breathing that, not to breathe more than what you need. Now, of course, if you are having symptoms, respiratory symptoms, your breathing is naturally faster, but don't exaggerate that. So when you feel breathless during rest, which is a symptom, of course, of respiratory dysfunction, a good way to help reduce the feeling of breathlessness is to breathe light, to breathe slow, and to breathe deep. So the sensation of breathlessness is reduced and alveolar ventilation is increased when you reduce the respiratory rate. So when you are thinking about breathing, breathing is not just about the number of breaths per minute, but it's also about the size of each breath, what's called a tidal volume. And the number of breaths per minute multiplied by the tidal volume gives you the amount of air or the volume of air that you breathe in 1 minute. You don't want to be breathing in excess of what you need, because that in turn, as I said, is causing bronchoconstriction. The second pillar is breathing using the diaphragm. Many people will talk about the benefits of taking a deep breath, but they often misinterpret a deep breath to be a big breath. A deep breath is not a big breath. A deep breath is manifest by lateral expansion and contraction of the lower ribs. So as you breathe in, the lower 2 ribs should be moving out, and as you breathe out, your lower 2 ribs should be moving in. Now, why do we slow down the respiratory rate? Well, the reason being is because every breath that you take into your body, not all of that air reaches the small air sacs for gas exchange to take place from the lungs into the blood. Every breath that you take, 150 milliliters of that air remains in what's called dead space. A certain amount of air will remain in your nose, in your throat, in your trachea, in your bronchi, in your bronchioles. So dead space, if you're breathing fast and shallow, you're taking a lot more breaths per minute and you're leaving a lot more air in dead space. When you reduce the respiratory breath, when you reduce the respiratory rate, you are not wasting so much air to dead space. The key with breathing is to enhance alveolar efficiency. Breathe slow, breathe light, breathe deep. Now, when you are having feelings of breathlessness, it is sometimes difficult to slow down your breathing. And the reason being is because your breathing is already labored and there is a feeling of air hunger or a feeling of suffocation. But a good way to help get your breathing under control and to help calm your breathing is to do many small breath holds. So anytime that you have symptoms, whether it's coughing, whether it's wheezing, whether it's breathlessness, a good way to help control your breathing is to do small breath holds. And this goes as follows. Take a normal breath in through your nose, a normal breath out through your nose, pinch your nose and hold your nose. 5, 4, 3, 2, 1. Let go, but breathe in. And then you breathe normal for 10 seconds. And again, take a normal breath in through your nose, a normal breath out through your nose. You pinch your nose with your fingers. 5, 4, 3, 2, 1. Let go, but breathe in. Breathe normal for 10 seconds. And again, take a normal breath in through your nose, a normal breath out through your nose. Pinch your nose and hold your nose. 5, 4, 3, 2, 1. Let go, but breathe in and breathe normal for 10 seconds. And again, normal breath in, normal breath out. Pinch your nose and hold your nose. 5, 4, 3, 2, 1. Let go, but to breathe in and breathe normal for 10 seconds. It's important that the length of your breath hold time doesn't disrupt your breathing. And the rule of thumb is that the length of your breath hold time shouldn't be any more than your control pause or the measurement of your breath hold time that you measured at the beginning of this webinar. If your breath hold time is 6 seconds, then the length of time that you should hold your breath during this exercise is only 3 seconds. In other words, we want to try and control breathing, but we don't want to hold the breath for too long that it causes a loss of control of breathing. When your breathing is labored, it's very important, don't breathe fast and shallow, because that will only feed back into your symptoms. So again, with a breathing emergency exercise, For coughing, for wheezing, for labored breathing, take a normal breath in and out through your nose. Pinch your nose and hold your nose. 5, 4, 3, 2, 1. Let go, but you breathe in, and then you breathe normal for 10 seconds. You will get a more detailed description of this exercise on YouTube. If you put in the exercise, How to Stop Asthma Attack and Panic Attack by Patrick McKeown. So that's an emergency exercise that we use for those symptoms. So typically people with labored breathing, including people with asthma, but also people with anxiety. And if you are feeling anxious at this point, there are two things that you can be doing. And one is gently slowing down the breath, as we spoke about at the very start. Don't breathe fast and shallow, because it will contribute to agitation of the mind. There is a link between your diaphragm and the emotions, and there's also a link between the speed of your breathing and the emotions. Fast and shallow breathing is fight or flight. It's a stress response. So in other words, if you are feeling in a stress response, you need to do the opposite and don't take those deep, big breaths that people normally tell you to do. If you take big, deep breaths, you are blowing off too much carbon dioxide, and this will cause blood vessels to constrict. This will cause what's called a left shift of the oxyhemoglobin dissociation curve. But ultimately, the more air you breathe, the less oxygen gets delivered throughout the body. Don't have the belief that it's good to take more air into your lungs. If you breathe hard, you will feel lightheaded. That's not a sign of increased oxygen delivery to the brain. What has happened there is that the hard breathing has got rid of too much carbon dioxide from the blood through the lungs, and the loss of carbon dioxide reduces blood flow to the brain. So when we did this small little breath hold exercise earlier on, by breathing in through your nose, by breathing out, by pinching your nose for 3 to 5 seconds and then letting go, you are helping to harness nasal nitric oxide in the nasal cavity. Nitric oxide is produced in the nasal cavity. It's produced in the nose, and it's also produced in the paranasal sinuses. But nitric oxide has antiviral effects. It's an antibacterial, it's antimicrobial. It's not produced in the lungs to the same quantity as it is produced in the nose, and it's not produced in the mouth. Only way to harness the antiviral properties of breathing is through the nose. When you breathe through your nose, you can harness from 50 to 200 parts per billion by nasal breathing, but you can also enhance this to as high as 3,000 parts per billion by humming. If you look at the research by Professor John Lundberg from the Karolinska Institute in Sweden, he talks about humming increasing the production of nitric oxide, or at least getting nitric oxide out of the paranasal sinuses into the nasal cavity by humming. So you're taking a normal breath in through your nose, and then you're humming a prolonged exhalation, and you want to vibrate your sinuses. Then after you have your exhalation on the hum, make sure you breathe in through your nose. The nitric oxide produced by the humming, you need to carry that into your lungs. Nitric oxide sterilizes the air, but nitric oxide also helps to redistribute the blood throughout the lungs, and it increases oxygen uptake in the blood by about 10 to 15%. So nitric oxide is the body's first line of defense against viruses. Now, despite this, World Health authorities are not talking about the importance of nose breathing. And when I'm talking about nose breathing, I'm talking about nose breathing during rest, I'm talking about nose breathing during physical exercise, and I'm also talking about breathing through your nose during sleep. So people who are not infected, it's vitally important that we do 2 or 3 things. 1, make sure that you are breathing through your nose at all times. Number 2, if you are in the presence of somebody who is coughing, hold your breath. Don't take that air into the lungs. When somebody is coughing or sneezing or even breathing, if they are infected, they are exhaling water particles into the air, which is like an aerosol can that's spraying. that aerosol can travel 1.5 to 2 meters. And if you were in that proximity, you were inhaling these water particles into your own body. When these particles with viruses come into your own body, the virus can replicate. The person who is not infected should absolutely make a concerted effort to breathe through their nose, to hold their breath if they are in the presence of people, of members of the public, and also to breathe as light as possible. And to give you an example, I've just been traveling and I only finished up on the 17th of March, I got home. And I was exposed to large groups of people in trains, in planes, in packed subways. And I did one thing. Whenever I traveled, I make sure I breathe through my nose, but I breathed hardly any air as possible. Now, breathing hardly any air as possible is going to do two things. One, you're not taking as much airborne air into your lungs. Number two, the slower you breathe, the higher the concentration of the slower you breathe, the higher the concentration of nasal nitric oxide. If you really slow down your breathing, and when I say slow down your breathing, I'm talking about slowing down your breath to the point almost that you feel hardly any air coming into your lungs. So you're taking a really soft and slow, gentle breath in through your nose, and then you're having a relaxed and a slow and gentle breath out. You should breathe almost to the point that you hardly breathe any air. Now, of course, you are breathing. And at the same time as you are breathing, take the air into the lower regions of the lungs. The greatest concentration of blood in the human lungs is in the lower lobes. It's not in the upper regions of the lungs. Mouth breathers are going to be breathing more air. They have no defense. And also they are ventilating the upper regions of the lungs, which in turn automatically reduces oxygen uptake in the blood. Mouth breathing also can get rid of too much carbon dioxide. Carbon dioxide is not just a waste gas. The release of oxygen from the red blood cells to the cells is dependent on the presence of carbon dioxide. Your blood circulation is influenced by the pressure of carbon dioxide in your blood. People who have cold hands, it indicates that they have poor breathing patterns. Your hands should not be cold. The blood vessels in your hands, your circulation in the hands should be enough that you feel warmth in the hands. So going back to when I was traveling in the tube, I felt air hunger for the duration of the travel. I deliberately reduced the amount of air that I was taking into the body. I slowed down my breathing to harness a greater concentration of nitric oxide. I'm carrying that nitric oxide into my lungs, and it's a natural bronchodilator. It sterilizes the air. It plays a role in the production of surfactant. And surfactant, the role of surfactant in the lungs is very important for helping to maintain elasticity and movement of the lungs. Covid19 impacts the production of surfactant. Nitric oxide improves the production of surfactant. If you look at some of the new patents and trials that are happening at the moment in the United States, I just published on Facebook, some of these trials are looking at the benefits of nitric oxide, inhaled nitric oxide, as a potent treatment for COVID-19. Our nose produces this gas naturally. The key is to harness it. Now, it's not just enough for non-infected people to breathe through the nose. We also need infected people to breathe through their nose. And here is the reason why. When you breathe in through your nose picks up moisture and heat, and you are taking that warm and moist air into your lungs. But on the exhalation, your nose traps this heat and moisture from the exhale breath. Nose breathers emit less moisture into the atmosphere than mouth breathers. If an individual is breathing in and out through their mouth, they are emitting a lot of water vapor and a lot of water particles out of their mouth. There is a 42% greater water loss breathing out of your mouth than from your nose. Your nose traps that moisture. So if an individual, if any of you think that you may have symptoms, and if you are in the presence of other people, reduce your breathing and keep your mouth closed. Don't emit so many water particles into the air, because those water particles are a means of transmission of the virus. So to give you a few pointers, I would also say to you is make it a concerted effort to keep your mouth closed during sleep. You need to protect your airways. You should never wake up with a dry mouth in the morning. You should always wake up with a moist mouth in the morning. Even if you are, say for instance, long-term, we've always advocated nasal breathing during sleep. Mouth breathing causes unrefreshed sleep. Lighter sleep increases the risk of snoring and increases the risk of obstructive sleep apnea. We have encouraged people to tape their lips, tape their mouth, so that they breathe exclusively through their nose during sleep. Now, I know some of you might be apprehensive about that. There are different tapes on the market. What we have traditionally used is you can buy in any pharmacy, 3M 1-inch micropore tape. You place it across your lips. It's a very simple paper tape. It's hypoallergenic, and you can get it in a chemist, a drugstore, or a pharmacy. Another tape that's very good, and it's by a doctor in Colorado, is called lip seal tape, and they are strips that are purpose made for placing across the lips in order to ensure nasal breathing. Another tape that we developed it for kids, is called Myo tape. And Myo tape simply works like this. You simply get the tape, you press it around the mouth, and it's elastic, and it brings the lips together. And that's Myo tape. So you have different options. If you are apprehensive about wearing the tape across your lips, I suggest that you get Myo tape. If you are thinking about children, don't tape their lips. Myo tape would be a much better option because it's not going to cover their lips, because it surrounds the lips. 3M 1-inch micropore tape, this one has served us very well for 20 years. Lip seal tape, lipsealtape.com has also served us well. So I'm giving you 3 options there. I'm just going to close by doing a 3 or 4 minute slow breathing practice. And this is not just beneficial to do if you have symptoms of breathlessness. And remember, when you have symptoms of breathlessness, it is difficult to slow down your breathing. So when you have symptoms of breathlessness, you can try this exercise or try many small breath holds. Or you could do it by simply walking for a small amount of paces. So if you're having symptoms, and I'm talking about symptoms of wheezing, coughing, breathlessness, a good way to help get your breathing under control, hold your breath for 3 to 5 seconds during rest, and at the end of the breath hold, make sure you breathe in. So in other words, you take a normal breath in through your nose, a normal breath out through your nose, you pinch your nose, you hold your nose for 3 to 5 seconds, then you let go, but you breathe in. You need to carry that nitric oxide into your lungs. You need to harness the antiviral effects of nitric oxide as a natural sterilization of the air as it comes into the airways. After you hold your breath for 3 to 5 seconds, breathe normal for 10, then hold your breath for 3 to 5 seconds, then breathe normally for 10. If you're having symptoms, of course, medical help this is not a replacement for medical help, but what I would say to you is practice that exercise for up to 10 minutes every hour. And I know that sounds a lot, but when people come into me with COPD, with severe asthma, with high anxiety, I have them practice the small little breath holds because I want to get their breathing to a point where I can give them slow breathing. So that's one exercise. The second exercise is take a normal breath in and out through your nose, pinch your nose, and you hold your breath for between 5 and 10 paces as you walk. Then let go, breathe in through your nose. Don't do if you're pregnant. That's also a very good exercise to do. So again, you take a normal breath in through your nose, a normal breath out through your nose, you pinch your nose, and you walk for 5 to 10 paces holding your breath. But again, when you let go, you want to breathe in. Now, that exercise also is going to harness nasal nitric oxide, and it also will slightly increase carbon dioxide in the blood, and it can have a bronchodilation effects on the airways, and also it can help reduce the sensation and the perception of breathlessness. The very thing that we feel like doing when we are feeling breathless, we want to breathe more air. We want to breathe faster and shallow. It is absolutely the wrong thing to do. If you look at the recommendations coming from China in terms of breathing patterns, and somebody did send me on the PDF from doctors which are recommended with patients who are post-treatments of COVID-19. Number one, they are telling them to monitor their blood oxygen saturation. You can buy these little devices on Amazon. They are relatively inexpensive, for maybe $30. You put them on your finger. It's got a little red light and an infrared light, and it tells you how fully loaded is your blood with oxygen. To increase alveolar ventilation and to increase oxygen uptake in the blood, you put your hands, again, I'm just giving you a repeat what we did earlier on, either side of your lower two ribs, have your mouth closed, you're breathing in and out through your nose, and then start slowing down the speed of the air coming into your nose. And at the top of the breath, you have a very relaxed and slow, gentle breath out. And the whole objective is that in terms of slowing down the breath, you want to breathe slowly and you want to take the air down into the deeper regions of the lungs. If you breathe slow, you are not wasting as much air in dead space. Whereas if you breathe fast and shallow, you are not ventilating your lungs as optimally as you should do. Now, that exercise too can be very helpful. And if you are not having symptoms, it can be very helpful in terms of normalizing your breathing patterns. So you breathe light, you breathe slow, and you breathe deep. So you're really slowing down your breathing, and at the top of the breath, you're having a relaxed and slow, gentle breath out. Now, of course, that exercise is a lot easier to do when you are not having symptoms. If you are feeling breathless, and as I said at the very start, your breath hold time that you measure does provide a good indicator of the functioning of your lungs. If there's bronchoconstriction or issues with the lungs, it will manifest in a lower breath hold time. If you are seeing that your breath hold time is reducing, it's really time to start doing breathing exercises. So, you know, it's like, as I said, when you are feeling breathless, if your respiratory rate is 30 breaths per minute, you won't feel like slowing down your breath, but I'm saying really try to do it. But you might find it easier to do the small breath holds because that's the emergency exercise. So I give you 2 small breath hold exercises. You've also got slow breathing. I'm also talking about the importance of nose breathing, both during the day and physical exercise, by the way, and during sleep. It's really, really vitally important. When we talk about breathing, the worst type of breathing we can do is fast, shallow, and through an open mouth. We have absolutely no protection. I cannot make a claim that nose breathing is going to protect against COVID-19. The disease is new. But if you look at the research of nitric oxide, it is plausible to say that whatever chance you have of defending the body against COVID-19, you have absolutely no chance if you are breathing through an open mouth. And whatever chance you have, it is when you use your nose, both to breathe in and out of the nose. And again, in times that when you are faced with individuals who you think they are, if you see them coughing, hold your breath, walk away, reduce your breathing volume if you can't hold your breath, but keep breathing through your nose. And even if you feel air hunger during that, don't worry about it because it's actually good. We deliberately get people to slow down their breathing to the point of air hunger to allow carbon dioxide to increase in the blood. And when carbon dioxide increases, they start to feel warmer. They start to feel drowsy. It's a very good exercise for insomnia. It's a very good exercise for people who have agitation of the mind. And also so by practicing slowing down the breathing volume to increase carbon dioxide in the blood, You know that carbon dioxide has increased when you feel air hunger, but when carbon dioxide is increasing, it can help to open up your airways, your blood vessels, 70,000 miles of blood vessels in the human body. You can influence your blood vessels, not by breathing hard, but by breathing light. It is not healthy to breathe hard. I know there's a belief often out there that the more air you bring into the body, the more oxygen gets delivered to the tissues. It is not correct. If you want to look at the physiology of it, look at the Bohr effect discovered back in 1904 by a Danish physiologist called Christian Bohr. If you want to go a little bit further, look at the oxyhemoglobin dissociation curve and look at how the red blood cells release oxygen to the tissues. The red blood cells release oxygen from the blood to the tissues in the presence of carbon dioxide, possibly nitric oxide, increased temperature, and 2,3-bisphosphoglycerate. So all in all, if you wanted to bring a breathing routine in, because I'm going to I wanted to give you 20 minutes and we've doubled it, but that's how it goes. Just really focus on your breathing, and we will post this video up on our page on Buteco Clinic. So it's butecoclinic.com/corona-virus, or is it butecoclinic.com? I'm going to actually just post it now so that you have it, because we won't be able to cope with so many emails coming in. My colleague Anna won't be too happy. So it's butecoclinic.com, corona-virus, and you'll see where I listed the signs, the benefits of nasal nitric oxide, and I talked about humming being a tremendous means to increase nitric oxide. And I see somebody here has put a post out there in terms of, yep, there's different yoga techniques, like all of these things that have often came from the East. Yogis knew there was something behind them. They knew that it worked. They mightn't have known the science. The science is catching up. It's not about taking big breaths. It's not about breathing hard. It's about breathing subtle. It's about breathing light using the diaphragm. Slow, light, deep breathing. And if you wanted to hum, I would say hum between 60 to 80 times a day, 4 times a day. And when you're humming, you're taking a very soft, slow, gentle breath in through your nose, and then you are humming for a prolonged exhalation, but then make sure you breathe in through the nose, because nitric oxide that's released from the paranasal sinus into the nasal cavity, you want to carry that NO into your lungs. There's no point in breathing in through your nose, humming, and then breathing in through your mouth. That's no point. So you take the breath in through your nose, you have a prolonged hum, exhalation, and then at the end of the exhalation, when you feel you need to breathe in, you're having a breath in through your nose and you're carrying that air slowly into the lungs, and that's what NO will do. Okay, I'll just end by going, if you were relatively healthy and if you wanted to influence your immune system, we have very little research on it, but breath holding can be a good way to do it also. There was one paper by Cox looking at the Wim Hof technique. We don't do hyperventilation, but we do breath holding. So it can be good, and also to decongest your nose so that your nose is working better. And that exercise is simply take a normal breath in through your nose, a normal breath out through your nose, pinch your nose, and walk holding your breath, and keep walking until you feel a medium to strong air hunger, then let go, but breathe in through your nose. But if you are feeling breathless, don't do that. So, in a nutshell, to measure your breathing, measure your breath hold time. It gives you a good indicator of how well you breathe. You want to be 25 seconds plus. The goal, of course, would be 40. The second thing is, make sure that you are breathing through your nose all of the time, and breathe lightly with gentle lateral expansion and contraction of the lower ribs. The third thing, if you are feeling breathless, don't breathe fast and shallow, even that's the way you want to breathe. Instead, breathe very slow, very deep, because that will enhance alveolar ventilation. Also, if you are feeling breathless, it can be difficult to breathe slow. Then do small breath holds. to try and calm down your breathing and to harness nasal nitric oxide. If you want to do a slightly different method to doing the small breath holds, breathe in through your nose, breathe out, pinch your nose and hold and walk a few paces, holding your breath, then let go and breathe in. If you want to have a practice to increase nitric oxide, breath holding does it, slow breathing does it, and humming does it. You increase nitric oxide between 7 and 15 times by humming, but in between your humming, make sure you nasal breathe. Have your mouth closed at rest, during physical exercise, during sleep. If you are in the presence of somebody who's infected, breathe hardly any air. If you do have the virus yourself, make sure you breathe through your nose and make sure you keep your mouth closed. Try not to spread water droplets everywhere because it does increase the risk of other people taking it. If you want a little bit of the science, go to that paper, buteyko.com/corona-virus. And I've put the references at the bottom of the page so you can look into it a little bit deeper yourself. Thanks very much, everybody. All the best and good luck with that. Take care. Bye.